Research Institute. My name is Rahman Nurwani. I'm a researcher in the SMERU Research Institute. And I'll be serving as your moderator for today. And on behalf of SMERU Research Institute, I would like to thank you very much for your coming all the way in this rainy day to to attend a very important presentation by Emmanuel Skoufias. Today he's going to present his paper on synergies in child nutrition, interaction among health and environment, care practice, and food. Okay, shall I introduce Emmanuel Skoufias? Because I'm sure that most of you have already known him. Oh, you don't. Okay, I will introduce Emmanuel Skoufias. Emmanuel Skoufias is a lead economist at the Poverty Reduction Group at the World Bank, Washington. Other experience at the World Bank includes a senior appointment at the Poverty and Gender Group in the Latin American and Caribbean region. Emmanuel Skoufias earned his PhD in economics from the University of Minnesota and a bachelor degree in economics too in the University of California, Berkeley. Is that right, Pak Emmanuel? Before we get started, I think it's also important to me to announce some important technical things. That first, our discussion will be last for 2 hours until 12 o'clock. And after Pak Emmanuel's presentation, we are going to have a question and answer session, a discussion session, in which you can raise your questions or thoughts directly to Pak Emmanuel. And also, and after that, we're going to have also a lunch together. Okay, I think now we're moving along to the main agenda. So I would like to please welcome Pak Emmanuel Skoufias. Pak Emmanuel, the floor is yours.
Okay, thank you very much for the kind introduction and for the opportunity to present in this prestigious institution, which I had the opportunity to watch from its very first days, when it was early created back in the late 1990s, 98, 97, I don't remember exactly. Well, and thank you all for, again, coming here. So, actually this work that I will present here is just the beginning. It's not, yes, it's a full report that exists and you can read it, but it's mainly the objective of this report is mainly to provoke the thinking about the issues of nutrition again, because I think from the last few years that I've been working at the World Bank, I think some things are sort of tend to be forgotten. I noticed that a lot of things tend to be forgotten, and the main thing that I noticed was the focus, for example, in the World Bank, to emphasize what you call nutrition-sensitive interventions in different sectors. And I will explain later what we mean by that. But my by being engaged in various activities of the World Bank on nutrition-sensitive interventions, for example, in agriculture, or nutrition-sensitive interventions in social protection, I became frustrated because I realized that nobody was sort of taking the helicopter view, if you like, of what are the problems for malnutrition in any country and how we can deal with this. And instead, every sector was trying to do something about nutrition by themselves without considering what the other sectors are doing. So after working for a couple of years on these issues, I realized, I thought, well, let's do something that is trying to serve like a wake-up call. And of course, then when you start looking at the literature, you realize that there is, back in the 1990s or late 1980s, there was the so-called UNICEF model of nutrition, which emphasized the main idea of the UNICEF model of nutrition was that a lot of things are very important for nutrition, and synergies are a key aspect for fighting malnutrition. In other words, you cannot do an intervention in one area while ignoring the other areas. For example, you cannot just give food to households if their sanitation and water facilities are not adequate. That was the original idea of the UNICEF framework, and I think everybody agrees with that you need to have what you call multi-sectoral interventions in order to solve the problem of malnutrition. But then, although everybody agrees with that, over the years somehow the compartmentalization of operations or thinking about issues has led to this strange situation where you have projects of the World Bank in Bangladesh trying to, working in agriculture, and they're saying, and their argument is, we are doing an agricultural intervention, and our agricultural intervention is nutrition sensitive, which basically means what we're going to do is we're going to because malnutrition is a big problem in Bangladesh, we're going to encourage households to grow vegetable gardens in their yards. And therefore, if they have vegetable gardens, then they can get fruits, they can get all the vitamins they need, and that's going to be very good for fighting malnutrition. From an agricultural perspective, that's great. But the fact is that, in Bangladesh, they don't have toilets. And the animals run around the yard, and the children play around, on the excrement. So when you think about this, you say, what on earth are you guys doing? What do you think you're going to achieve with this kind of intervention? Yes, you call it nutrition-sensitive agricultural intervention, and you satisfied some bureaucratic checklist. Oh, is it nutrition-sensitive? Yes, is it? But in fact, this is not going to have any meaningful impact on the problem of malnutrition. And yet, as we speak now, they are doing this in many places of the world. These kinds of interventions. Yeah? So this is the motivation for this work. And of course, there's hardly anything new in this report. Yeah. As I said, what we're trying to do is we're trying to say, yes, there's some ideas that people and organizations and institutions put forth 30 years ago, 40 years ago about multi-sectoral type of interventions, but somehow these ideas have, dissipated or have become compartmentalized, and they're not taking that seriously. So we thought, okay, let's take them seriously, and let's see with the data that we have, what can we say about the problem of malnutrition, and where are the areas where households are really lacking adequate access to some key determinants or key services for malnutrition. So this is the outline of the study. So I think I will walk around. So I think I already talked about the motivation, and I will talk a little bit next about the contribution of the study, and then we'll talk about the UNICEF. The UNICEF conceptual framework. I don't know, anybody here familiar with the UNICEF conceptual framework? Once you see it, you'll say, oh, well, I knew that. That's not, it's called the UNICEF conceptual framework. And then how we operationalize this framework. Right? To our surprise, and if you know something, please let us know. Even though all the nutritionists around the world go around talking about malnutrition being a multi-sectoral problem, nobody has gone and sit down and sort of come up with a catalog of, okay, so all these are the determinants of malnutrition, according to theory or according to our knowledge. These are the data we have. Let's see, where's malnutrition and what are they lacking most in these areas where malnutrition is high. So let's do a catalog, a list of the areas that are lacking. But to my surprise, to our surprise, that has not been done, even though the UNICEF framework says this is key. And then we'll get into the details and then talk about synergies as originally conceived from the framework. All right, so as I said, I already talked about the motivation, but here it is in 3 bullets. We know that increases in GDP and income are not sufficient for reducing malnutrition. Certainly, income is an important determinant of malnutrition, but income can only go so far in reducing malnutrition. There's many other things that you need to do to reduce malnutrition. So, again, over the last 20 to 30 years, there's been this recognition that the determinants of malnutrition are multi-sectoral, and the solution to malnutrition requires multi-sectoral approaches. That sounds good, right? And everybody agrees with that. And from there, you've gone to this third stage, which is, well, you need nutrition-sensitive interventions in different sectors, and that will be the way to go. Which is, I think, the issue, what we are having a problem with. At least I have a problem with. So what is this study trying to do is, first of all, we say that if you're going to take the story about malnutrition being a multi-sectoral issue and you need multi-sectoral solutions for this problem, first of all, you need to have data. Otherwise, you just go in the blind. And one of the things that this study is trying to do is identify the areas where we're lacking. We have shortage of data, where we have no data that we can use to sort of catalog the areas where there's inadequacies in access to the key determinants of malnutrition. But at the same time, we think that this study informs broad policy design and choices. So it serves like a systematic diagnostic, and it can also be used to identify essential binding constraints, for example. And the study also provides evidence on the role of synergies. So, for example, is it better to give to induce households to grow vegetable gardens, or is it better to induce households to grow vegetable gardens and adopt latrines or toilets, proper toilets? The UNICEF model of nutrition would say that the latter, vegetable garden plus toilets, is the way to go, because by having vegetable gardens and toilets, you're achieving much more than just by doing vegetable gardens. Because vegetable gardens, actually, if you don't do anything about toilets, they're just a waste of time and effort. A parenthesis on this, although there was a study by, I think it's the Institute of Development Studies in the UK. They did a survey of the literature for 320 or 50 some type of interventions that are all about vegetable gardens. Yeah? And they, and some had impact evaluations with randomized controlled trials and things like that. Zero. Zero. None of these interventions had any measurable impact on malnutrition. Guess why? Well, obviously because they were not addressing the other problems of the other key determinants of malnutrition. You're only doing something in one area and you're wasting your time and money. Anyway, this is just a parenthesis. Of course, all the NGOs and all the institutions that were supporting these vegetable garden interventions were not very happy with this study, right? Well, how can you tell us, you haven't done this, you haven't done that? They're trying to criticize the study itself. And of course, every study can be criticized, but I think there's a fundamental issue here that is more important. All right. So, what is this UNICEF conceptual framework? So that was some framework that was developed as part of a report in the 1990s that basically said, okay, there's many determinants of malnutrition. Let's take these determinants and sort of classify them into three groups. These are the three groups. Food security. Now, food security, for anybody who has worked on this topic, it's a very vague subject. What is food security really? What does it mean? How can you measure this? So that's one. The other one is child care and practices. And the third one, actually you can divide this into two. Is environment and health. Right? So you can, it's not only have these three groups, but you can call them four groups if you put environment and health as separate groups. And they're saying, okay, these are the important determinants. And the fundamental idea is that back, when they did this report, they said, look, you need to have, there are synergies between these three pillars, if you like. And you cannot be progressing in one without progressing in the other two. At some point, if you progress in one, the other two, if you do nothing about the other two, they're going to start holding you back. So there's not going to be any impact on malnutrition because you are running into constraints. If you do child care, but you don't do anything about environment and health or food security, there's not very much you can do.
Yeah. What does it mean with the environment there?
It's water, sanitation, the characteristics of the household. Yeah. it's whether you feed, the frequency of feeding, the type of, whether you have interaction with the child, when you breastfeed the child, when you, we'll explain, what we did is, when we read this, we said, okay, so now let's consult with a nutritionist. So what do you mean about these things? These three buckets here are very, very broad. So what do you put in food security? What do you put in child care? What do you put in environment and health? And that's what we do. So we had this nutritionist who was working with us, surveyed the literature, the nutrition literature, and he gave us sort of a catalog of things that would go under child care practices. The nutrition science says that it's important to have, for example, eye contact by the mother with the child when the mother is breastfeeding the child. This for a nutritionist is very important. Okay, we said, good, give us this. You're saying that this is important. Then, when we go to look at the data, is there any data on these things? It turns out that there's absolutely no data about that anyway. Or maybe in the one study that did, in that particular case, to establish that eye contact of the mother is critical. But as a matter of fact, this information is not collected by any survey. And then, by doing this process, and by the way, working with nutritionists, it was a very interesting experience because you realize, we're economists, they're nutritionists. The nutritionists are much more normative oriented. In other words, they all sort of refer to how you should, or what you should do, or what you, economists on the other hand are more positive oriented, means how things are, and that is a fundamental sort of ideological difference between the two disciplines that is creating complications. And I just mentioned one, right? The nutritionist would tell us that eye contact of the mother is critical for, with the child, is critical for nutrition and child development, for child care. But, me as an economist, I say, yeah, fine, I agree, but there's absolutely no data, so I'm going to ignore this. For the nutritionist, that would be, that would be critical. For us, it would be something that we can ignore, and let's try to do the best we can with what we have. In a way, that also explains why the nutritionists have never done this operationalization of the UNICEF framework. Right? Because a lot of these variables that we would go under here actually never really measured or collected in surveys. Anyways, but we decided to go ahead anyway. We're not nutritionists. You say this is important, fine, but let's see what's available in the household survey that I can use to sort of make these ideas concrete, more numeric, more quantitative. Okay, so these are just some pictures of the UNICEF framework, which is quite general, and nobody can disagree with the framework because it has a lot of good basis. That for nutrition, you have the basic causes, the underlying causes, the immediate causes. Basically, the underlying causes are these three groups that I mentioned, right? The food security, care and feeding practices, and unhealthy household environment and inadequate health services. That's the underlying causes of nutrition. And then the immediate causes of malnutrition is inadequate dietary intake, diseases, and then you have the short-term consequences And of course, for every country, all these basic causes are critical also, you know. Social, cultural, economic, and political factors are important. But we don't do anything about this. We take this as given. Our focus is on this component here, on the underlying causes of nutrition. So now, that's basically the original UNICEF framework. What you can see is that this is the latest framework by the nutrition discipline from the Lancet Maternal and Child Nutrition series, which basically has enriched this original framework. But what you can see here again is that you still have these three basic underlying causes of malnutrition. They're saying, you know, food security is important, feeding and caring practices are important, and access to youth and health services and environment, hygiene and environment is important. But then they also added all these, you know, of course you can have nutrition-specific interventions and programs that you can, you know, like direct nutritional supplements, for example, that can have an impact on malnutrition. And also, you can have the nutrition-sensitive programs in the different sectors that would also play a role. And our point is, I mean, I came from this angle, right? I mean, I was working at the World Bank, and I was working in this effort to do nutrition-sensitive agricultural interventions. And I was sort of getting frustrated with the fact that, look, by just doing this, you're not doing everything. You need to have all these other things, right? Anyway, the point is that these three groups, right, you know, and as I said, you can call them 4 groups. You know, you can divide them. It doesn't matter if it's 3 or 4. Are key through in the evolution of thinking about relative determinants of malnutrition. All right. So what have we done then? What did we do? Well, first of all, we did a review of, I already mentioned that. We asked the nutritionists to tell us, okay, what are the ideal variables that we would need information on to talk about the determinants of malnutrition. So basically, we did a review and we said, okay, what does the nutrition discipline say about what's important under care, what's important for food security, what's important for environment and hygiene. And then we said, all right, you gave us this wish list, basically, which is what you think is important. Fine, we don't disagree. Now let's see what can we find in the household surveys that we can relate to these variables that you say are important. And then we did that next step, which is we defined, you know, a person may have access to a health service, or may get care, or a child may get care. And the question is this care adequate or not? It could be, it would not be proper care, for example. So then you need to come up with some thresholds that determine whether the access to these different components of the determinants of malnutrition is adequate or not. So how do we come up with these thresholds? Well, we consult the literature. You know, there's there's a whole bunch of studies by World Health Organization and USAID and UNICEF that sort of define this threshold. For example, what is adequate prenatal care? what you see is that you realize that when you look at the literature, there's these thresholds that exist out there, but then there's no clear justification, or at least the one that we could find, as to why the threshold is this and not that. For example, adequate prenatal care is considered to have 4+ prenatal visits to a doctor. For the pregnant mother to have 4 or more visits, and that's considered adequate prenatal care. Why 4 and not 3? You will not find an explanation, why 4 and not 3. So there's some things like that that are very mysterious, in the discipline out there, and the fact is that in a survey you might get that a lot of the women, pregnant women, have 3 visits, but only few have 4 visits. If you apply the standard of 4 plus visits for prenatal visits, well then the whole country is basically having inadequate care. So you can see that somehow these thresholds start playing a very critical role in all the messages that you hear out there in the news about, oh, Indonesia this, Indonesia that, has not achieved this, has not achieved that. You need to start questioning them. They're based on, they're based on some research, but then again, this research is not particularly well documented or explained or justified. Why 4 and not 3? In my survey, I see all the ladies, all the pregnant mothers have 3 visits, very few have 4. So if I use as a threshold 3, Indonesia would appear to be a country with very adequate health care, prenatal care at least. But you say 4, and then nobody has 4. So now the country immediately switches from adequate, completely inadequate. Things like that. So all this stuff is going through the internet now, right? So somebody's going to marketing. What is this guy saying? Okay. So anyway, this is where we got our standards, and I guess the message is that that's why this work is not finished, really. I mean, it's what we did is, in our exercise, we just took whatever these studies say, right? So to have adequate child care, you need to have 4 visits. If you don't have 4 visits, it's inadequate, and so on and so on. Okay? Yes.
Have you conducted research on the medical literature? I mean, I think that there is explanation in the medical literature about why 4 not 3. There must be without consideration.
Yeah, we haven't done that, but I mean, my point is though that when WHO or the World Health Organization says that it's 4, then they should explain why 4, and refer to that medical literature. I don't have to start looking for that medical literature to find it. But I'm sure there's probably a justification, and a good one, as to why 4 visits is better than, it's adequate health care. But I couldn't find, easily this justification. That's all I'm saying. Yeah? And if you think about it, it's a very complicated issue. To really determine whether 4 visits is better than 3 visits for adequate care, you need to have a very long-term study to determine, a very big study, a very carefully designed study to determine that. I don't know if the medical profession has done that yet or not. I mean, these thresholds are usually done with a study of 100 pregnant mothers in village X, right? And you know, the external validity of these studies is non-existent. But yet, because that's the only information available, they take, because this study in that village showed that 4 visits was better than 3, and then they go and they apply it to the whole world. Well, that may not necessarily be the right thing to do. So these are the kinds of things that you need to always be questioning, I think. All right. So, what did we do in this study? Our focus, our original intention was to do, rather than do one country only, we said, okay, let's just do it the best we can by focusing, let's say, on 2, 4, 6, 8 countries here from each of the regions of the world where malnutrition is a problem. And some of, why did we choose some countries and not others in this region? It was more about data availability, work going on at the World Bank. There wasn't any very strict scientific principle for choosing, why we use Bangladesh in Asia and not India. Because we happen to have data on Bangladesh, and so, okay, we use Bangladesh. Okay? So, and so on. And then for East Asia, we included Cambodia and Indonesia. And for Indonesia, we used the Skoufias data 2010. Which has, which is also, in a way, also a problem, because in Indonesia, the 2007 and the 2013 Skoufias surveys are representative at the district level. But 2010 is only representative at the province level. And then 2010 has a very detailed consumption module, but 2007 and 2013 do not. So there's all these trade-offs that one has to weigh. Now, just to because we're talking about Indonesia, the reason I'm here this week is because this work has attracted interest from a number of countries, and including the Ministry of Health of Indonesia. And we now have an agreement with the Ministry of Health of Indonesia where they're going to share with us we're working together. We're working together on the 2007 Skoufias and the 2013 Skoufias to do what you will see here today in a much more careful manner, which is specific to Indonesia, and more sensitivity analysis, and because whenever you do a cross-country study, you're never going to find the same variables across countries, so you're going to have to be limited to the variables to the few variables that are common across all countries. So then, then you start losing many of the country-specific sort of information, which we've lost here, for example, for the case of Indonesia, in order to make it comparable with the other countries. So this analysis that I'm showing you here today, it's actually better to do and more useful for policy if you do it focused on only one country and you sort of take into account all the information that exists in that country and carry out the analysis. Right? So here, anyway, we're just doing a cross-country study. So most of the samples in these countries are mainly rural, and in most of the countries, the surveys we use are the demographic and health surveys. The demographic and health surveys, are you familiar with the demographic and health surveys? In a way, the guess that is a demographic and health survey, but with much more information. But the demographic and health surveys are essentially the only surveys, together with the mixed surveys, so multiple indicator cluster surveys, that contain information about the determinants of malnutrition, like food security, or care practices, and environment, and sanitation.
Why didn't you use the DHS for Indonesia? So it's more comfortable.
Yeah, but the DHS in Indonesia doesn't have anthropometrics. Only Skoufias has anthropometrics. Yeah, that's a problem actually in a number of countries. The DHS surveys are usually the only surveys that have the anthropometrics. But in countries like Indonesia and also Philippines, the government has some rule, I don't know exactly what it is, perhaps you can explain to us. And it says, you can do the DHS survey, but you cannot collect the anthropometric, because we are the ones collecting the anthropometric with our own surveys. So that's true in the Philippines and in Indonesia. So actually, we are very happy to be able to have this agreement with the Ministry of Health of Litbangkes of Indonesia, because we are the only ones, it turns out, to be having access to this data and working together with the ministry. Lots of other institutions or groups do not have access to that data.
That's unfair.
Yes, I know. Write a letter. Okay, so as I said, we asked our nutrition collaborator to say, okay, what are under food security? What would you, when you nutritionists talk about food security, what would you put? What kind of variables would you need? What variables make up food security? Because food security is a very general term. You cannot only summarize it with one variable. You need lots of different variables, different dimensions to summarize food security. So he gave us a list here. Children's dietary diversity score. Of course, you can have calories, the hunger scale, the food insecurity, a lot of these sort of indicators that exist in the literature. And you can have the so-called starchy staple ratio. That's another indicator that has been used occasionally, which is the fraction of household calories derived from starchy staples. Out of the total calories, how many are coming from starchy staples like rice? So it tries to capture some measure of food variety, diversity. It's not just calories. As we know, calories is not everything. Not for me, it's I can have too many calories. I have a lot of diversity, but too many calories. Okay, and then you look at the literature, these are the different variables that are used to characterize food security, and then you can say, all right, let's go to the survey that is used to measure malnutrition or stunting. What can we find in that survey that can be used to quantify this variable? Yeah? What you can see is basically nothing. In the DHS surveys, you will not be able to find anything really meaningful about food security in the DHS survey, or about food diversity. One thing I wanted to say was also in our data. In Bangladesh, another reason we use Bangladesh is because we had there was a DHS survey, but there was also two other surveys, the Helen Keller survey and the IFPRI survey. IFPRI is a research institution which has started a big national panel of households interviewing, almost like the Indonesia Family Life Survey. Yeah? But it also collects anthropometrics and food security type of information. And so in Bangladesh we have the luxury to compare when you combine information from two different surveys that are very nutrition oriented. In most other countries, except Indonesia, you just have to rely on the DHS survey, the demographic and survey, whatever you can find there, that's what you have to work with. It's not in the DHS, forget it. You will never be able to say anything. Okay, so now it turns out that when you talk about food security in the DHS, there was, in the Ellen Keller survey, in the DHS survey, there's usually something about children's dietary diversity. And in particularly, you can also say something about minimum acceptable diet for children 6 to 24 months. But with regard to all the other sort of measures of food security, there's no information. Yes?
Yeah, actually Indonesia has the food consumption survey. It's
Yeah.
the food consumption survey, and then so we came again 2014 to the sample size of this is done 2014 only for food consumption. So we have the food consumption survey information.
Yeah. But here we're only using the 2010, which is for Indonesia. I need to check exactly which variable we use for the consumption from the survey. All right. So basically, these are the components for food security. That we could find sort of in a consistent manner across all countries. Yeah, in this survey. Something about the minimum acceptable diet, the minimum meal frequencies. In only one country we can say something about household level food insecurity. That's because that information was collected with the Helen Keller survey, but not the other countries, Bangladesh. And then something about the dietary diversity of children. Now, the next thing is the care, right? The next sort of group of what goes under care. Again, there's a lot, lot of variables that the literature suggests are important for nutrition. But then when you look at the survey, what can we find that we can call care? There's very little. Of course, you can say something about breastfeeding and complementary feeding. That's considered like a care behavior. But that's about it. There's not very much else that you can find. So whether the child was exclusively breastfed, that's usually a question that exists in the DHS survey. Then the initial breastfeeding within 1 to 3 hours of birth, and then whether complementary feeding was introduced during the 6 to 8 months, and then continued breastfeeding until 24 months. That's considered to be a measure of adequate care. That's a very strict. It's a very strict threshold, actually. Not many mothers these days breastfeed for my impression at least. All right, so the next thing is about environmental health. Now, it turns out that environment and health, environment and health. It turns out that this pillar, this group of variables, is the one that is best measured in most household surveys. Because this one is about water, having access to safe water, access to improved sanitation, community level sanitation, use of prenatal services, and again, you know, prenatal services, is this, perhaps that should be under care. Again, there's a lot of arbitrary decisions that have to be made. You know, do you want to put use of prenatal services into care, or you want to put it under health, adequate health services? Anyway, we put it under health services. And then immunizations, vitamin A, ORS, etc. So, but as you can see, most of these variables that are used to characterize environment and health are actually in these surveys. So you can have information in these surveys. And another thing that we did, which we think is, and we had to convince the Ministry of Health about that yesterday. We said we like to use the information of whether the household has access to improved water or improved sanitation. Yes? Fine, they gave us this information for every child. Then we said, but it's also important to know whether other households inside the community where the child lives have improved water and improved sanitation. Because you can have improved water and improved sanitation, but if everybody else around you does not, you know, there's, you know, it's going to have negative effects on your nutrition, right? Health. So now the Ministry of Health is calculating this community level, at the block census level actually. We're going to get the average, or the percent of households that have access to improved water or improved sanitation. So it's not just enough that you have improved water and water sanitation, but also your neighbors, right? Because there's all these externalities associated with water and sanitation. All right. So we did all this exercise. It was a very tedious and a lot of arbitrary decisions and choices made. But you know, we thought we have nothing to lose. Nobody else has ever done this, so why not? Let's do it. And so let's just try to finish this. And you know, in the process, we learned, I think, one important message is that there are basically major gaps in data that are collected by the demographic and health surveys, which, by the way, the demographic and health surveys for most countries are the only surveys that can say anything about nutrition in a meaningful matter at the national level. Yeah? And what we see is that if you're going to talk about nutrition being a multi-sectoral issue which requires multi-sectoral interventions, okay, fine, we can say that. But you know, now if you want to put numbers to it, or if you want to put percentages of population that have access to this or that, then you start running into problems because a lot of the variables that are important for malnutrition or nutrition in general are not even collected by the survey. Right? So if there has to be a serious effort about fighting malnutrition at the country level or at the international level, the first thing that I think needs to be done is in making sure that the necessary data are collected to support the choice and the decisions that have to be made. Because right now, a lot of the decisions, a lot of the knowledge is coming out from very opportunistic studies or very specific studies that have little, as I said, little external validity. But in the absence of any information at the national level, people are forced to generalize or to take whatever you find in a very focused, very localized study in one area and apply it for the whole country, if not for the whole world. So information and data are key for that work. Now, let's, just to show you where we're going. So now, we have all these components, right, of food, we have all these components of care, we have all these components of environment and health, whatever variables we have, and then we need to decide whether the access to each one of them is adequate. For that, we need the threshold, right? And then, but we know that adequate food security has 3 or 4 different variables in it, right? So here we applied a very strict standard. We said you have access to adequate food security if you have access to adequate level of each component of food security at the same time. Right? That's a very strict requirement. So when I say access to food security is adequate, that means that you have adequate access to any of the components of food, to all of the components of food security. Right? And the same thing for care. Care had, let's say, 3 or 4 different components, one of which was environment and prenatal care was under you need to have adequate access to all of the subcomponents to be classified as having adequate care, and so on for environment. So that's a very strict criteria, but nevertheless, we did that. Why? Why not? Because it's very, otherwise, how do you decide which one is more important? We basically assume that they're all equally important, and we said, okay, to say that you have adequate food security, you need to have adequate access to every component of food security that we have available in our service. Yeah? Now, of course, you can start trying different thresholds and different criteria, and hopefully we will do that with the Ministry of Health, because there's no need to be so strict here, right? But this is just to give you the first impression. So, what do you see here? What you see is that, okay, the UNICEF model of malnutrition says that these three pillars are important for malnutrition. But what you see is actually progress in these 3 pillars, or at least access to adequate level in these 3 pillars, is very uneven. There's been a lot of progress, or there's a lot of adequate access to care. 50% of the children have access to adequate care in Bangladesh in 2010. 29% have access to adequate food security, but only 13% have access to adequate environment and health. All right, now if you see this picture here, what would be your conclusion? If you were the Minister of Health or the President, what would you say? What's the next thing we need to do to reduce malnutrition? Would you say, oh, we need to increase care? You wait. Right, most likely, obviously this is the area where you have a lot of shortages, a lot of lacks. People don't have access to water and sanitation of course, ideally you want to make all these bars to be about the same level. You want to make them all to be 100%. But that's an ideal world. We'll never. Hopefully someday we'll be there. But at least that's where we are. And this tells you that you can this component of at least this important determinant of malnutrition is lagging behind. Or in other words, is acting as a binding constraint.
Do you have numbers for Indonesia?
Not as simple as this, because but I'm getting to it. That's why I said this work is more as an appetizer for doing the good work or the real work. Because today, yes.
When you say about indicators that you use to analyze this, and you mentioned, like, for instance, like the components of food security for the adequacy of food,
Yeah.
there are some indicators listed as proxy indicators. So it means that when you compare between countries, there will be some countries having more complete indicators and others less using proxies?
That's true, yeah.
Okay, so
Yeah, so it's very difficult to compare across countries, but we do it anyway. But I just wanted, but that's why I only showed you one country here, right? Bangladesh. This is what the data we have on Bangladesh only. All right? In fact, I do have graphs of Indonesia, but I don't want to. With the 2013 actually, but I don't want to. They're too preliminary. I don't want to. Right. So this one here gives you this picture that I showed you before. That's only for. Yeah, this is Bangladesh. Oh, sorry. One more thing I wanted to show you before I get to this is this. Now, you can also look at adequacies or access to adequate food security or adequate care or adequate environment for the children residing in poorer households or richer households. Right? And again, the poor or rich can be done with a principal components index based on assets, or it can be done based on consumption. It doesn't matter how you do it. But the question is, okay, how do the poor and how the rich compare in terms of access to food security, care, and environment? And does this graph make sense? Well, it makes sense, but it also creates some additional interesting issues. What you see is that as far as food goes, the poor have lower access to adequate food compared to the rich. And the same thing for the environment. That makes sense, right? I mean, the poor don't have enough food, don't have enough proper environment. But care is about the same. Which actually is something that we find in many countries. Which is good. I mean, it's encouraging because that suggests that one interpretation we have is that a lot of the effort in the past decades of international organizations or NGOs have been essentially about proper care, and it's easy to do something about that. Relatively easy to do something. You design a community program. You send a few. Community workers, train the mothers, education about proper disposal of the feces or proper feeding practices, food diversity. You can do a lot of things in a fairly inexpensive manner to improve care practices among malnourished populations. But it's much harder to do something about access and utilization of food, or certainly about water and sanitation, or health water and sanitation, you need to build a network, right? And the government needs to be very, it requires a major investment. Okay, so now this one here is rather than giving you the adequate food as a group, you look at each component. You know, what are the for each country? In Bangladesh, using the Heller, or East Please survey, Bolivia. There's Indonesia. Indonesia is here. And Indonesia actually is doing very well on food security. We have dietary diversity and exclusively breastfeeding. But again, there's the issue of whether these variables are comparable to, because this survey is slightly different than the other surveys from the other countries. The other countries you use DHS, Indonesia you use Skoufias, right, 2010. But anyway, if we, you know, in general, as far as the variables, the two variables we have on food security for Indonesia, there's quite a lot of children have access to adequate food security. 86% have access to proper dietary diversity, and they're exclusively breastfed. There's a big fraction of children are exclusively breastfed at the age of less than 6 months. But we don't have meal frequency or food security. Well, this is how things evolve over time. I mean, I'm not in Indonesia. We only have 1 year, so there's no way we can talk about evolution over time. In some of the countries, we have surveys, let's say in 2000 and then 2009, 2010. Okay? But in Indonesia, we only have one. But now we will have 2007 and 2013. And this is the pattern that you get across all countries with respect to the adequacy of food when you compare the poor and the rich in each country. Right? You know, you get things that make sense. It's what you would expect. As far as food goes, at least, having access to adequate food. In most countries, the richer households have better access to food security than the poor households. Now, in fact, if you have a survey like the Skoufias, which is representative at the district level, you can do this picture for every district, 550 total, if you like. Your computer will do it for you. So my point is, you know, you can get this tableau, if you like, or this dashboard, you know, which is very simple. It's just descriptive statistics of how each province, how each district does in terms of adequate food. Again, this is adequate food security, which has, remember again, there's 2 or 3 components under food security, and you need to have access to all 3 to be classified as having access to food security, to adequate food security. Yeah. In each country, you have the DHS gives you as an asset index based on principal components. Asset index. Principal components. You put everything and then you divide it into bottom 40, top 60.
Sorry, just a question.
But in other countries like Indonesia, you can use consumption. Yes?
Sorry, in most countries you can see that similar percentage of children have access going
Who's
from...
talking?
Yeah, sorry. Handstanding.
Yeah.
Is that saying that for those countries, children from poor and rich background have same access to adequacy of food?
Can you repeat that, please?
Is your graph saying for those countries listed below, it's the same percentage of children from a resource poor compared to a resource rich. So the percentage of children who meet criteria are very closely similar to for those countries. Like,
Yeah, basically that's what it says. I mean, for example, here, right?
or suppose IDN is Indonesia.
Yeah, or Indonesia, they're very...
Yeah, so it's saying 67% of children from the poor background has got meet the criteria of food adequacy.
Based on the
compared to
two
60.
variables that we use to identify food adequacy for Indonesia, yeah.
Okay.
But remember, in other countries, there's 3 variables or 4 variables under food security. But in Indonesia, we only have 2. Okay. Yes, it says that they're about the same between rich and poor. Now that might be a bit puzzling, but that's why we're doing the study again. So hopefully we'll see whether this holds. Yes?
Why do you think there's such discrepancy between the two Bangladesh surveys?
Yeah, again, it's you know, how many variables you put in food security here compared with here. Yeah, Bangladesh includes food security, but no information on minimum acceptable diet. Oh, and by the way, in Indonesia, we only use household level diversity, dietary diversity, nothing else. So we only use one variable in the case of Indonesia to classify whether you are adequate or not. Whereas the other countries have more than one variable. Also, that explains why most likely this is highest compared to the other countries. Because it's based on only one. In all the other countries, you have a lot of variables and you need to have adequate level of all of these variables to be classified as adequate food. All right. This again, it will give you a sense of the care. Again, I mean, I don't want to spend too much time because we're busy right now. But again, the thing that is interesting about care, and I think it's worth highlighting, is that when you look at care and you compare rich versus poor in each country, and again, remember, care has many components, but when you look at care, the poor are actually doing slightly better off than the rich. Across, in many countries, it's not just one, you know, which again, we think our interpretation of that is that it's a reflection of the effort that has been put in community level type of intervention by different organizations and NGOs towards improving care among target populations, which are usually poorer populations. But again, remember, if you take a step back, that says, okay, that's fine, but that's not going to be the solution to the problem, right? You need many other things in order to reduce malnutrition, right? You need environment, health, water, etc. Okay, so now let's look at let's go to figure. Now this is environment, and we have the poor and the rich again. And what do you see here? In care, the poor are doing better than the rich, but in the environment, in pretty much every country, yeah, the richer are doing better. So these are some powerful graphs, I think, right? I mean, if you show them these to a policymaker, you know, some things start clicking. But it also sort of confirms the fact that you know, this exercise is not completely meaningless, right? I mean, what we do is, however imperfect the data are, which we know they are imperfect, and however, you know, we're not really representing the true UNICEF model of malnutrition because we're lacking information on many variables. At least with the ones we have, we get things that are, we get some sort of results that are in accordance with our priorities, with our expectations, right? I mean, yes, we expect that the richer have better environment than the poor, and the data is showing that here. And this is, let me just into health. And the same thing with health. Access to health facilities and things like that. Again, the richer households, the children in richer households have access to better health, adequate health care, adequate health facilities. Even in the all right, so now, that's where things become a bit, we need to do more work on this, but you know, if you were to say, okay, where are things better and where are things worse, you know, it seems like care is the pillar that children have most adequate access, and food security is second, and the lowest access is on health and environment. Now, one needs to sit down and do a system, and I'm telling you because I think this is important. One needs to do a systematic analysis of how these rankings may change if you have, remember, what we put under care sometimes is only 4 variables. What we put under food security is only 2 variables. What we put under health and environment is, I don't know, 3 or 4 variables. Okay? And this ranking depends on how many variables you have in each group, because that's going to make it less likely. The more variables you have, the less likely it's going to be that you have adequate access to, let's say, health and environment. If you only have 1 variable, you're more likely to have access to that group. Right? You get the same issues in the multidimensional poverty estimation and what weights do you apply to different components of poverty, different dimensions of poverty. Now, the other thing that, now whether food security or care are you know, second or third, let's leave it. But for sure this is third, and this is the component for which we have the best data. Health and environment, this is the components for which you can find the data that you need for the in a survey. And that may be the reason why health and environment appears to be at the bottom. Because you have more information on you have more variables, and when you apply the criterion for adequacy, that makes it lower and lower and lower, because to be adequate in health, you need to have adequate access to every component of health, and to every component of the environment. And that makes it, you know, very unlikely that you're going to have access to all of them, and that makes it very low. Right? So this is just some warnings about this. All right. So now one can go on and do this kind of analysis and sort of examine the correlation patterns with stunting and access to adequate access to these variables, the different components. Basically, I mean, I'll just skip the pictures. What you see is that you have a correlation and probably a likely causation between the decline in standing in these countries that we have in our study and increases in the prevalences of adequacies. So basically, as the children, the number of children, the proportion of children with adequate access to these different components increases, you observe a decline in the standing rate. Now, that does not establish causality, but it's comforting to know that this is what you would expect, right? What you would expect is that the more adequate food you have, the more adequate health, the more adequate environment you have, the less likely you're going to be stunted. And the data generally shows that. But again, it doesn't mean that you should go ahead and take this as granted and formulate policy based on that. But in general, there has been efforts to increase care, access to care, to adequate care, but there's basically little progress towards improving health and environment. And that may be the main binding constraint right now for improving stunting rates across countries. On the food story, we don't have any clear, it's a very mixed picture that we get. It depends on the country, it depends on the variables that you use in that country, so it's hard to say something meaningful. So what I'm going to do now is I'm going to shift to the issue of synergies, okay, because that's in the title anyway, right? So now, as I mentioned, the original model of UNICEF said that having access to more than one of these pillars is critical for improving malnutrition. So this gives you a picture here, or in the case of Zimbabwe, what is the fraction of children that has access to, that doesn't have any access to adequate level of any of these three pillars. What you see is that 47% of the children have no access to adequate health or environment or food security or care. 8% have only access to adequate food security. 23% have access to care, adequate care only. But the point is, if you have access to only one of them, that's not enough. You need to have access to the other pillars, right? And what are the only 15% of the children have access to any two of the three pillars. And then you can go do this analysis in more detail. Which two? Which are these two? Is it health and environment, or is it environment and care, for example? And how many have access to all three of these? 2%. 2%. So again, that gives you a sense of to have synergies, right? To have synergies, you need to have access to all three. That we're very far away from achieving that. Very far away from achieving that. But and certainly we're very far away from achieving at least having access to two of the three. So what we've done here now is we're looking at the same picture now for every country. This is what we had for Zimbabwe before. This is now for all the countries. And looking at Indonesia, only 33% of their children have access to two of these three pillars, access to adequate levels of 2 of the 3 pillars. And all 3%. Only 3% of the children have access to all 3 pillars. Same as Zimbabwe. But it's not only Zimbabwe, it's not only Indonesia. Look, this red is the same in Bangladesh, it's the same in well, Ethiopia is almost 0. And you can do that for the resource-rich and resource, so the poor and the richer households. But now, the last part of this report is more about, I don't know, how many here are familiar with econometrics? Have you heard the word econometrics? Anyway, so the last thing we do is we basically, again, this is not causality analysis, it's just correlations about how does the height for age Z-score of the child, on average, what's the average height for age Z-score of the child when you have access to care or food or health and environment, or you have access to 2 of these at the same time. Care and food, or care and health and environment, or food and health and environment, or have access to all 3. Now, the UNICEF model emphasized the synergies. Econometrically, or at least quantitatively, a synergy means that if you have access to care and food, your average level of height for age would be higher than just having access to only care, or just having access only to food. So for example, from this model here, you can see that the coefficients give you a story. Basically, they tell you what's the mean average of height for age for those who have access to care but not food or environment. These 2 coefficients tell you the average height for age of those who have access to care and so on. These 2 coefficients, alpha plus beta 2, tell you what's the mean value of height for age of those who have access only to food, and so on. Those who have access only to health and environment. These coefficients, gamma 1, 2, gamma 3, etc., tell you what's the extra benefit that you get by having access to the 2 pillars simultaneously. In other words, you're getting something, this is what you get if you have access to care. This is what you get if you have access to food. And this is the extra, if you like, gain in height for age, in the mean height for age, that you get if you have access to food and care at the same time. Right? And all we're doing here is we're testing this idea. The Synergies idea is that by having access to more than one, you get something over and above to having access. I think the expression in English is you get something over and above that is the sum of its parts. Right? So basically, we want to test whether these coefficients are positive and significant. These coefficients here. All right, and this is what we get. What we graph here is these coefficients of synergies. And what you see is that they're all, well, the majority, 18 out of 25, which is a good proportion, they're all positive and significant. All right, what does this mean? What this means is basically that there are synergies In other words, there are strong benefits associated with having access to both, to more than one of these components, these pillars, at the same time, in terms of increasing height for age Z-scores.
I don't understand this figure. Can you explain it? Because you have 3 environments.
Yeah, it's all the interaction terms here. It's all these coefficients of the interaction terms. Okay?
Okay.
For each country, And what you see is that all these coefficients are, for each country, or most countries, they're positive.
What's the explanation for the negative coefficient?
Negative synergies. Yeah, it's sort of data. There's no intuitive explanation for that. We're just going with the overall picture. Right. Yeah, so basically, I just wanted to get to this last message, which is there are, like the UNICEF model says, and like we all believe, that there are strong synergies by having access, simultaneous access to not only care but also health and food security. And what this study, in a way, is doing is sort of reminding people that yes, this is what the UNICEF model is all about. And you shouldn't concentrate on only one sector, only care, or only food, or only health and environment. You need to take the big picture, keep the big picture in mind, and it's how well you progress in improving access to all the other important determinants of nutrition. So basically, countries with malnutrition problems have great potential in exploiting such synergies. And perhaps we need more renewed effort on doing that. Yeah.
Do you have numbers for the last coefficient?
The 3. I don't have it here.
Positive or negative?
It's positive, but it's not significant in many cases, because it turns out that in our, because the fraction of children is so small that has access to all 3, that 2% that I showed you in Zimbabwe, it sort of creates issues with standard errors. For the 3. Magnitude, I don't remember now, but it's positive. Magnitude, size of the coefficient, I don't remember. But the sign and okay, so what do we get? What is there to, what's the takeaway from this, from all this discussion that we just had? Well, basically, we need more emphasis on exploiting these kinds of synergies across sectors and not focusing on only one sector. Now, of course, that is the message of the nutrition field for many years to come. But the point is that they never backed up, as far as I know, this message with something concrete like numbers, as we're trying to do here. Yeah. And we certainly need much more data, more systematic data collection to try to fill all these data gaps that we have about the important determinants of nutrition. And one way of sort of thinking of the sector-specific nutrition-sensitive intervention, these are also trying to exploit some synergies. Yes, there are synergies within the sector about building or about giving incentives for somebody to have a But these synergies probably pale in comparison to the synergies associated with having interactions across different sectors, you know, like having water and sanitation and a vegetable garden at the same time. That would be, there are more synergies from that rather than just synergies that you get from growing a crop and then growing a vegetable garden, holding water and sanitation to the level that it is non-existent level. Now, the question that this raises is that if you're going to believe this synergy story across sectors being important, the question becomes, who in a government is the one who is keeping track of this big picture? You tell me. I don't know. There's nobody, actually, as far as I can tell. And the problem is that also within the World Bank, you have exactly the same problem. You have every sector, you have the education people, they want to invest in education. You have the agricultural people, they say, oh, we're going to invest in agriculture, and food security is important for us. And then you have the water and sanitation people that say, oh, water and sanitation is the important thing. And they're all looking at their own little things, and they all say, okay, well, we all worry about nutrition. Nutrition is a very multi-sectoral problem, so what are you going to do about it? Well, I'm going to do nutrition-sensitive agricultural interventions. Or I will do, but don't laugh, but that's how it's done. And then the other one says, well, I'm going to do nutrition-sensitive social protection interventions. And I will do nutrition-sensitive X, Y, and Z. Nobody keeps track of this big picture and the underlying determinants of malnutrition. Neither at the World Bank nor at the government level. Hopefully, in Indonesia, for example, there's this movement, not only Indonesia, there's this international movement called the Scaling Up Nutrition, the Sun movement. And the point of that is to sort of increase awareness and coordination across ministries to on the issues of nutrition, and to bring out these issues in a better perspective. But this is only starting now. And all of that, again, it has not been based on any kind of analysis like it is here. However imperfect this analysis is. So I will stop at that and take questions. Which I will not answer every question.
Thank you very much, Pak Emmanuel. Very interesting, and I think this is very relevant to Indonesia context because despite many efforts we have done and some progress we have had, but malnutrition is still a big problem for us. And here we 1/3 of our under 5 children is stunted. So I think this is always been a very important discussion for us. And for that reason, I would like to open the question and the discussion sessions. And for that, I would like to have maybe 3 questions, and Pak Emmanuel will answer and continue to the next question. First question. Yes, don't forget to raise your hand and mention your name and institution. And we have 3 now. First is Pak Asep, Bu Marita, and the lady over there. Okay, maybe Pak Asep first.
Thank you, Rahma. Sebelum bertanya, saya ingin mempersilahkan yang ingin menikmati teh, kopi, dan snack, silakan.
Not nutrition enough?
Okay, congratulations, Pak Emmanuel. I think this study is very neat. Yeah? It's simple, but it's very powerful. I hope you can continue your efforts in convincing people of the messages that is gained from this study. But I have a few questions, a couple of questions on the econometrics. One, did you pull all the household data from all countries into a single database and estimate the model just one? If yes, wouldn't it be better to estimate separately for each country?
No, it's by country.
Oh, by country. Secondly, I understand the limitations with the data availability, but I suppose this model will be better if it is estimated not contemporaneously, but using some kind of lag model. Maybe not at the individual level, but at the regions level, which might be possible if it is that bigger. Because perhaps the effect of this whole intervention is not contemporaneous. I think that's fine. Thank you.
Okay, thank you very much. My name is Asmarita. This is a very good presentation. Maybe I would like to add information about this synergies analysis. We have like what we call public health development index that we create from Skoufias, which has 30 indicators, and then we have sub-index for 30 indicators, and then we have done analysis, something like that. So actually we have information, for example, for sanitation and for health status for health, and then for children, and also health status for women, and then also about the sanitation and behavior. I forgot the second index, sub-index based on the public health development index. Actually, it also put it in the books that I just give it to you. And then my really question is about the UNICEF conceptual framework. It means that actually for Indonesia we have done for assessing the underlying factors related to malnutrition, but the basic cause actually never done. So, for example, the politics, yeah, and then cultural problems related to the malnutrition, and then this is really important for us because of disparities and everything, and also first of all the politics. And maybe we have done advocacy and everything about the malnutrition, but it's really depend on the head of the district or the head of the provincial level. So what do you think about this? So I mean, for Indonesia cases, it means that we really would like to work on the basic cause of this UNICEF conceptual program. The other side is it seems that everybody understands about it. But when we are talking about social, cultural, politics, and education, for example, so it's really related to the malnutrition. That's why the stunting is never reduced, but even before from the 2000, it increasing. 2000 before 2000 is less than, for example, stunting is about 25%, and now it's increasing into 37%. So this is increasing, and because of the, I don't know, is it ignoring of the people, or I don't know. I think this is the basic cause that's very important. Thank you.
Thank you. My name is Iti. I really enjoy your presentation. I'm working with the national team for the poverty the national team for the acceleration for the poverty reduction. I'm very interested with your diagram for the adequacy status. It seems that countries who have the combination of the two, the number is quite okay, but it's significantly drop when it comes to the combination of three, only like 2%, 3%, something like that. Yeah, and then you have the other graph that shows all of the countries. What are the two? Is it similar between countries? What are the combinations? Is it food security and care, or is mostly care and health and environment? Or I mean, it's really, I think it's really interesting to know what are the combinations. And the next question is a different combination will give a different benefit? For example, I understand that we have to synergize for all the three aspects, but if country with a very limited resources, if they have to prioritize, which are the two that give the most impact? Thank you.
So I can answer that.
Please, Emmanuel.
I'll start with the third one first. Actually, you hit it on the nail, as they say. It's originally that was how we started the study. We started the study. We're going to be able to use this analysis to prioritize. If you have only care, should I give you? Is it better to have care and food, or is it better to have care and health and environment? That was a good idea, but I think in practice, to do these kinds of things, you need to be very careful about causality and identification sort of issues, which in the profession of economics these days is everything. So in economics these days, you only answer these kinds of questions with randomized experiments. If you don't have a randomized experiment, you're just going to be torn apart. If you try to say something based on sort of cross-sectional type of analysis. So we've tried to, moderate, to be very moderate in terms of how far we're going to push this type of analysis to draw inferences about policies. Probably for the right reasons, but certainly the temptation is there. Yeah, it's very. I want to spend the time to see if I can say something useful for policy. Exactly this question. If you only have care, is it better, more cost effective, or whatever, more effective for malnutrition to give food, or is it better to give? But the recipe, it's you can. Hopefully, you can do it, or somebody else can do it. So in general, yeah, that's why we have also reduced the, in this graph here, we just said, okay, any two of the three adequacies. Yeah, in principle, we can do this graph where we say, okay, which two? Care, is it better? And in fact, hopefully in Indonesia, we will do that. Now when we focus on only one country, we can look into these things in much more detail, and maybe something will jump out, and it will be very easy and obvious to derive conclusions with. But no, at this point, we decided not to. We devoted time. Let me tell you, we devoted time, but it just we encountered too much opposition from the profession. Now, regarding your Dr. Marita's question, yeah, I would like to know much more about these indexes that exist already, and I certainly agree with you on the political economy or socio-cultural factors that are important for malnutrition. I think that the best one can do in this kind of analysis is to at least provoke discussion. Yeah. So And one of the things that we are doing is because, by the way, it took us 2 years with the Ministry of the Bankers team to get to this point that where we are now. 2 years. Because it took so long time, we decided, oh, perhaps we can have as a backup strategy, we can do this same kind of analysis, but at the district level, using SUSENA's data for all the adequacies, yeah? And then the district level malnutrition data from the schedule, because that's publicly available. The malnutrition rates or stunting rates for each district are available in the publication. So, we have that, and we are in the process of at least sort of comparing, at least coming with some descriptive graphs again of okay, how are the inadequacies in different districts, and how is the spending on the money allocated from the center to the districts. For example, the money allocated from the center to the districts, how is that spent in different sectors, like health and health mainly, or nutrition would be under health, spending at the district level, right? So, I think a powerful graph there is to show that, look, the central government is transferring more funds to the poorer areas, which, because of the Dow formula, right? With the Dow formula, Human Development Index is part of the formula, and some of the indicators are there. And you get more money if you have a lot less, lower scores in some of the human development indicators, including unlike malnutrition, the stunting rate is one explicit. I don't think so. It's just a photo. So one powerful graph is to show that, look, the government is giving money to the districts, and you can show that more money goes to the districts with lower malnutrition rates, because basically the Dow formula gives more money to the districts with poverty, higher poverty. And high poverty and malnutrition are quite strongly correlated, yeah? But then when you look at the spending of the district, how does the district spend this money? Yeah? Do the districts that have higher malnutrition spend more on health? When you do this graph, you see there's a zero correlation between the spending of the district on health or education and the malnutrition rate. So now I'm hoping that once somebody sees this graph, will say, look, I mean, the central government is at least trying to do something about it. What are the districts doing about it? They're not spending the money in the issues that are the indicators, to improve the indicators that are should be a concern to them. Now, I mean, as an outsider, I think that's the best we can do to sort of get the discussion going. But I think these are also important issues for the Ministry of Finance, right? I mean, they're really concerned about whether they should move away from Dow to DAC, which is more tied spending based on performance, and tied to spending in specific sectors. So, and they are considering changing this formula. So this way, at least they will tie force the districts to spend the money or more money in issues related to malnutrition. I come from the quantitative side, so at least from our side, that's the best I think we can do just to generate the discussion. Yeah?
Yeah, I think we have all the indicators, but we don't have the information about that budgeting the district level. So maybe that if we can combine that, maybe it will be
making sure that all these spending of governments, district governments in different sectors become consistent and comparable across time. So there's the data. So we have a data set that will can be used to get some of these descriptives problems. But the more political economy issues and in a sense, I leave it to you, somebody else. Now, regarding your question, yeah, it's. I mean, there's a lot to be done. I mean, in this area, and we've only scratched the surface. And originally, we wanted to rather than running these regressions. I mean, the problem is that whenever somebody runs a regression, you always interpret the coefficients as sort of saying, okay, what is the change in the dependent variable with the change in the independent variable, right? So, but that presumes or implies some sort of causality, yeah? And a lot of the concern in the econometrics literature is whether this coefficient here is to say something about causality, you need to make sure that all of these variables are not correlated with the error term, right? So this is you have truly exogenous variables included here. But the fact is that none of these variables here is exogenous, right? Everything with regard to care is about behavior, right? It's about whether you take your child to the clinic, whether you feed the child. These are all choice variables. Therefore, all of these variables are correlated with the error term. Because, what's the error term? The error term is all these other things that play a role in determining height for age. So it summarizes all the unobservables, if you like. And therefore, you're going to have endogeneity. And there's nothing you can say about causality with regard to any of these coefficients. So we are trying to be very careful not to do that and resist the temptation to do that. But on the other hand, something that we always forget is that basically a regression is a mean. It's a way of summarizing. It's also a way of summarizing mean values. So in other words, and that's how we're trying to use this regression. Okay? It's basically what is the mean value of height for age for those who have access to care only and not food and I think that's the best we can do with considering how complicated this problem